Waiting more than an hour in the waiting room is unfortunately very common in many doctors' offices. Telemedicine can provide relief. Telecommunication assists in communicating findings and creating a care plan. The Institute for Applied Telemedicine IFAT at the Heart and Diabetes Center North Rhine-Westphalia in Bad Oeynhausen provides care for patients close to the facility and abroad. Telemedicine is a method that utilizes forms of communication, information and telecommunication systems to provide care for patients. These patients are generally not directly here on site with us, but at their home or en route somewhere, and are assisted by physicians or nursing staff with the help of these technical options. There is also another type of telemedicine where physicians compare notes with each other, discuss specific medical findings, give a second opinion, and where colleagues are asked for input. And then there's the type of telemedicine that takes place between patients, the type where patients compare notes with each other in communities, web forums or self-help groups, and where they get to talk about their experiences with their respective disease. Measuring instruments such as body weight scales or an ECG device send daily data to the staff via Bluetooth. Here at IFAT, the program generally works this way. At the start of the program, patients receive their medical equipment to take home with them. We instruct them on the phone how to use these devices. This might be a blood pressure monitor, body weight scale, or an ECG device to monitor suspected cardiac arrhythmias, for example. The nursing staff and physicians take a look at the data, analyze it, and, if needed, talk to the patient on the phone about the respective data. There are frequent conversations with the patient. The conversations serve to train the patient and to coach him or her in very specific subjects: diet, exercise, medication, lifestyle, risk factors and symptoms. These are all topics that are being discussed with the patient so they become knowledgeable about their disease and ultimately live a better life without the need for this type of medical support. Great collaboration between medical staff and patients is vitally important in telemedical care. The primary duties and responsibilities of patients when it comes to our care program is operating the technical instruments, meaning to take measurements on a regular basis, and measuring the vital signs that are currently relevant to a patient's chronic heart disease, for example. Obviously, the patient also needs to participate in the care process. He needs to take his medications and also make some lifestyle changes if necessary. He also has to continuously communicate with his general practitioner. All of the participating telemedicine physicians take part in a coordinated care program. The responsible physician creates a care plan beforehand and makes all important decisions related to the treatment. There are two courses of action in case of emergencies. One emergency situation occurs if the patient calls us, sends over medical data, and we notice very unusual pathological values. For example, the patient might send us his ECG readings, which show an acute cardiac arrhythmia. In this case, you must act immediately. In these types of situations, we contact our colleagues, our physicians, and the local emergency medical services. That means we contact the respective rescue service in the patient's region. He then receives emergency care. If the patient does not call us directly, but just sends us this type of pathological and abnormal data, we try to reach the patient ourselves, or if we can't reach the patient, we try to contact family members or other helpers. This method is especially well suited for patients with chronic conditions that require frequent monitoring. The immediate provision of care is obviously one benefit of telemedicine for patients. That means the patient can immediately send us his or her medical data, we are able to immediately assess it and get back with the patient. Another benefit of telemedicine is cost savings, of course. Now, patients don't necessarily have to visit a clinical facility, a general practitioner, physician practice, or see a medical specialist. Patients can stay home instead and receive care at home without the need to visit specific infrastructure facilities. What's more, physicians can assist more patients during the same period of time.